Questions about the U.S. coronavirus death count have taken hold inside the White House, officials familiar with the matter say, as President Donald Trump and his aides discuss whether figures used by administration to determine mortality rates and death projections are reliable indicators for plotting a path forward. As nationwide case numbers show a steady decrease, Trump and some of his aides have begun questioning whether deaths are being overcounted, according to people familiar with the matter, even as the president publicly attests to the accuracy of the numbers. The top medical expert on the White House's coronavirus task force, Dr. Anthony Fauci, has said the opposite could be true, that coronavirus deaths are being undercounted as people die at home without going to hospital. But inside the West Wing, officials said there have been steady doubts about coronavirus figures arriving from the U.S. Centers for Disease Control and Prevention, either because they are behind or potentially skewed. In meetings of the White House task force, senior officials have raised questions about how the agency is compiling and tracking its data. The death count questions illustrate the degree to which Trump and his allies have begun to scrutinize the data and advice emerging from government sources. Death counts are questioned, models are doubted, recommendations are debated and discarded, and medical experts, even those widely trusted by the American people, are viewed with suspicion. As the president agitates for a national reopening and looks ahead to November's election, his allies and even some of his own advisors have sown distrust in the institutions and data which underpin his coronavirus response. Trump himself has waded only intermittently into the fray, leaving his supporters in Congress, the White House and conservative media to plant seeds of skepticism in government facts and figures. But he hasn't tamped down on the efforts and, through his actions, has largely discounted the guidelines set forth by his own experts. Trump has been less enthusiastic about the various models that have shown U.S. deaths rising or falling based on various mitigation factors. These models have been so wrong from day one, he told ABC News in an interview this month, voicing a level of skepticism on both official and unofficial models that has existed among his advisors for weeks. Even Dr. Deborah Birx, the White House coronavirus response coordinator, has raised concerns with how the CDC has collected and reported some of its data, including death counts, according to officials familiar with the matter.